We start our scientific session with an address by Dr. Sangeeta Pikale. Dr. Sangeeta Pikale is a practicing obstetrician and gynecologist. She is the director of Pikale Hospital and an ex-president of Association of Medical Consultants, Mumbai. Ma'am graduated from LTMMC and completed her post-graduation from KEM Hospital. Ma'am also has a diploma in hospital management from Bombay Management Association. Ma'am intervened in the public interest litigation of insurance imbroglio and played a vital role in creating Maharashtra Medicare Service Persons and Medicare Service Institutions Act, a law protecting doctors against violence. She has been an active member of City Space and Friends of Trees with a passion for reducing carbon footprints in India. I request my colleague to please present ma'am a token of her appreciation.
She wants a photo. Come.
Welcome, ma'am. Please address the delegates on the topic, the arts, science, and commerce of medicine. Thank you.
Yeah, thanks. Will the audience be dark? Can I see their faces? Is that possible? With a little light? Good morning. And like Madam Deshmukh said, I always like to say namaskar. I'm extremely honored to be here at my alma mater. Most of my learning and most of what's happened in my life has happened at Sceince Hospital. For me, this is not where I can be called a guest. This is where I should always be a host. I have lived in the Sceince campus from my second standard because Dad was Professor HOD of Surgery and subsequently Dean of Sceince Hospital. So for me, Sceince, every building that's come up, I have seen certain drawings in home, sketched and drawn, and slowly buildings come up. I feel like a Scienite, like some other previous speakers have spoken. Though I did my postgraduate in KEM, I feel like a Scienite always, and I think I'll always feel like a Scienite. I thank the Dean, Dr. Suleiman Merchant, the team Trinity, the very enthusiastic Mr. Sudarshan, to be Dr. Sudarshan, and the entire team of Trinity for inviting me. And when the students came to me and said that they'd like me to speak on a subject which is not clinical, not scientific, I chose what is my favorite subject, the art, science, and commerce of medicine. But why do we need to know the art, science, and commerce of medicine is because we want to achieve success. And therefore, the roadmaps to success would be on the way a milestone called professionalism, but the skill you use would be the art, science, and commerce of medicine. So for this, what you need to do is define success. Unfortunately, today success is defined by only two things, money and power. And if that was the true definition of success, most of our mothers who lived at home and raised us would be defined unsuccessful. But if you ask your mothers, they're very happy because their roadmap to success and their definition of success was caring for us. And therefore, define your success before you begin your journey. If you want academics, so be it, be in a teaching institute. If you want money, you need to chase tertiary care, high-paying patients, and others. But define your success, otherwise you'll get lost along the way, comparing yourself with others. We are the GPS for you. When you go on a road, you need a GPS. We are the Guru programming service. So as I defined success, I thought, let's figure out what are we as doctors. And I read a lot on the net and saw a lot of quotes. One of them, which I've put up, but the other which I read, which is an anon written, it says doctors are literate, ignorant, bunch of science practicing individuals. And then I went into why literate, why ignorant. It's because our diseases are defined as a cause as idiopathic. And just yesterday when I was talking to Ram, he said possibly they are, and a friend of mine had also said that, the doctors look idiotic and the patients pathetic when we don't know why diseases happen. People who come to us vary not just from culture, race, genetics, allergy patterns or otherwise, but we also have somebody called as believers and non-believers. So they come from different understandings. And let's look at the medicines. They are launched with a fanfare as panacceas, and very often, very soon, they are taken back. Almost 30% of the products are pulled back from the market when the post-marketing trials showed dangerous results. So here we are in an unknown domain, yet scientifically skilled. There's a hostile scrutiny on doctors. I'm going to spend a little time on your focuses and why till we come to the art. We've been swinging from being called gods and now even criminals. So we are arrested when we fail in our duty. So we've swung from being Bhagwan to now Shaitan. You are our hope. Like our previous dignitaries have said, you are our hope that you'll bring back some of the faith that we possibly could not inspire in the community. Professional competence is something we therefore need to seek. And when we look at professional competence, what we find is that the most important aspect of professional competence is communication. It's not your knowledge, it's not your skill, it's not your technical understandings, but it is your communication and being able to build confidence in the community. Remember, very important, that it's very difficult to predict death, but even more difficult to guarantee life. So let's not be dogmatic. What is expected? Here I'd like to say something very interesting. I had this patient of mine, in Badia we had learned 18 hours of labor is what you should wait. After that, cesarean karne ka, because partogram pe you go into action line. So we used to plot it and we used to do a Caesar. I had this patient of mine about 15 years ago. She was in labor for almost 24 hours and patients refused to sign the consent. As usual, what I had learned from Sceince and KM, Dama discharge. Patient took the Dama discharge, they told me they went to Sceince hospital. I kept pursuing the RR to find out what happened. I didn't know what happened, and about another 14 hours later, the husband comes, कि घर पे लेके गया, बच्चा पैदा हो गया, अच्छा है. I thought, what happened to the Vadia training? I thought there was something aberrant. I wanted to see the baby. We called for the baby, and the pediatrician said the baby is absolutely fine. What did it tell me? It didn't tell me that she was an abnormal case. It told me science has not documented it all. And there's a lot more documentation we need to do, and these are the patients who will teach us that the science we know has its limitations. The community has defined a lot of professional, they've said there's a charter on professionalism, and this charter on professionalism expects us to be the heroes, better than the Amitabh Bachchans and better than everybody. We have to do everything. We also have to have a just distribution of finite resources. We will say municipality ne material nahi diya, but you will still have to, whatever resources you have, you will have to make that, last for the last patient. We have to manage conflict of interest. The 21st century saw a paradigm shift. From a single solo relationship of a doctor-patient, suddenly we were an industry. We were called providers, and the patient became a consumer. What we sold was no longer health, it became a healthcare product. Then became another thing where the patient never paid for his health, the insurance sector started paying for his health. And we had people like Amir Khans and everybody who knows that generics is better, how much to investigate, and everybody, you pick up the paper and every day there is medical news. In all this changing scenario, the most important change that's happened is the decision making is now handed over to the patient, and we cannot make decisions in spite of the fact that we think we know it all. Why do we have a moral context? A lot of times when we are having dinners and friends are together, we say, lawyers ko itna nahi laws apply hota hai, teachers ko nahi hota hai, so many professions, they are not answerable. Why are we to be so answerable? I'll tell you why. Because we are the closest to God. And I'll tell you how. When a baby is born, the birth certificate is signed by the doctor. So when God sends somebody on earth, we sign and say, yes, he arrived. And then when a man dies, we say, send him back. We certify birth and death. The two dates on the tombstone are both certified by the doctors, and therefore we have a moral context and we cannot escape it. We have to be honest. And so when patients ask me, Doctor, dukhanar kai? You know, when doctors say, kai dukhanar ne? Never say that. That's a lie. You say, dukhanar, but me prayatna karen to reduce the pain. Scar rahanar kai? I'll try to minimalize your scar. How much will it cost me? Don't give a lower cost. Patient's going to be very angry if it goes high. It's better to give them a correct costing. You have to be able to be honest, empathetic, and explain why, and the patient will be yours forever. Spend time now with the patients. Otherwise, spend time litigating. For you as residents, what are the few things you need to know? You have to know what the patient wants. The patient wants only to know 4 things when he comes to you. He doesn't really care of how much you know and what. He wants to know what is wrong with me, what is my treatment, will I need admission, how soon will I be fit, and how much will it cost me. And like many textbooks of medicine, Cecil and all other books, there's a discourse on art of medicine. And therefore, let's talk a little about the art of medicine. One of the days that I was, experimenting with my art of medicine, and a patient said, "Doctor, लोग आप लोग बात करते हैं, पेट को हाथ लगाते हैं और फिर बोलते हैं कुछ नहीं, या कभी-कभी बोलते हैं गांठ है, आपको कैसे समझता है?" I looked at him very wisely and said, "आपने कभी कलिंगड़ वाला देखा है?" He was smiling. I said, "वो कलिंगड़ को टिक टिक मार के लाल है कैसे बोलता है? और उतना ही नहीं, वो टिक टिक करके मीठा है करके भी बोलता है." Fellow smiled very wide. I said, "क्या हुआ?" He said, "साहब, मैं होलसेल का कलिंगड़ का बिजनेस करता हूं." And he understood what was clinical science. And I had my chapter on understanding of the human body just by examination or by history. Spend time on history taking. If you feel the patient is not opening up enough, you need to give him the moment of privacy. Take him to the side and ask him a few questions, because he may not be wanting to say everything in front of his mother, brother, father, sister, wife, whatever. You need to give him. You need to observe your patient very carefully. Sometimes the body is telling you something, the words are saying something else. And if you have got the wise eye of watching them carefully, you will never miss a diagnosis. Here again, I'm going to share a small anecdote. Sai Baba tile wala, I go to buy tiles with him. He's at Parel. And I always go to buy something. And I said, "गिराई का आया है, आप उधर गए नहीं गिराई को देखने?" He's saying, "साहब वो आके नुमाइश करके जाने वाला है, देख के जाने वाला है." I said, "तुमको कैसे मालूम?" He's saying, "चाल से समझता है." So I said, "How do you know चाल से?" He's saying, "मैं बताता हूँ." He went to the customer and he showed me. This guy only looked and went. Another 5 minutes later, another customer walks in and he says, "ठहरो, मैं जाता हूँ." And he goes immediately attends. I said, "आपको कैसे समझता है?" He's saying, "धंधे में हूँ, समझ में आता है." And then I said, his skill of observation was brilliant. He knows who's going to buy his stuff and who's not going to buy. We have lost these skills slowly, and we have lost the art. My father used to take clinics for us, and I remember him telling us appendicitis, how he walks. He used to hold slightly on the right iliac fossa and walk with a tenderness. And right when the patient walked into the clinic, he used to say, "You know it's appendicitis." So in my pregnancy, in my practice as I'm a gynecologist, I kept watching my pregnant women very carefully. And today, I can tell whether she's less than 14 weeks. I can tell whether she's 20 weeks or whether she's 34 weeks just by seeing her, even from the back or even from the front. Once I know she's my patient, I start watching very carefully. And if some of you know, at 34 weeks gestation, pregnant women have a very typical walk. They start walking like penguins, legs apart, and they walk entire body and torso. Diastasis, this is the patient. You need to watch them very carefully. You know a patient who's had an episiotomy from a LSCS. You know a patient who's having a wound infection right when they enter. You have to know your patients. You have to have social awareness. There are patients, during your history taking, remember very importantly, there are two people examining each other. You, the patient, and patient is watching you. The patient judging you. ये अच्छा डॉक्टर है क्या? Should I pay him 500 rupees? Should I get operated from him? Will he really do me justice? He's judging you. He's watching you. He's examining you. This is the time you will impress upon him. This is where your word of mouth publicity is happening. This is where your patient becomes yours forever. Capture him here. You don't need any marketing tools or holding tools. You don't need anything else. In fact, you need less investigative modalities too. You pick up here whether your patient is a believer. So you have different classes of patients, according to me. One are called believers, the others are called disbelievers. The believers want Jethropa oil application, they want flaxseed, they want naturopathy. They want it from an allopath after diagnosis, but they don't want medicines. The disbelievers and the believers in technology want medications, investigations. They want to be involved with a whole lot of investigation. During this art of history taking, you pick up what the patient would like and offer him the science that is applicable to him. He's going to be a satisfied customer. If not, you're going to offer him the different kind of medicine he doesn't desire. He's going to change the doctor. So Dr. Daftari had once told us that during history taking, if a Parsi asks you, "Idu khawai ke na khawai? Do I eat an egg or don't I eat an egg?" He says, always say "Idu khawai." Because if you say "Idu na khawai," the doctor will be changed. Because "Idu to jo hai." So you have to know cultural backgrounds. You have to know what they like. And if you can understand that, that's the time when you are actually doing the art. Watch your people very carefully. I had done a course on body language. It was done by one person called Kiran Relangi, who even advises the film industry on how to create characters. And I have learned certain skills. Maybe one of the days I'll do a workshop with you. If you know a person and you've been watching him for a while, you can make out when he's lying. You cannot make out what the truth is, but you can make out when he's lying, because there is clustering of eye movements, hand movements, shoulder movements, and a body language. So if you know a person for a while, you know whether he's lying. So if you know a patient and you are very observant, you start knowing when the patient is lying. And that's very important for a clinician to know. He may be lying out of fear, he may be lying out of many other reasons, but as a clinician, you have to know it. Learn the art of body language, or you will have to go into evidence-based medicine. And what is evidence-based medicine? What your eye and soul could not see, you ask a machine to seek. And it's going to be very difficult for the machine to seek what the eye and the soul can't see. Listening. I had this patient who had a wonderfully written history seen by a doctor, and I thought an amazing clinician, because itna neatly notes likha tha. But the patient first when he came said, "Doctor, वो डॉक्टर को मैं मिली थी, लेकिन वो तो बात ही नहीं कर रहे थे और सुन भी नहीं रहे थे. मैं बात कर रही थी, वो लिखते जा रहे थे." And I said, this was very early in my practice, and then I realized that listening needs to be demonstrated. Listening is not hearing. Listening needs to be demonstrated with ha, don't worry, I'm there, मैं हूं ना. That kind of an expression. You have to keep doing it when the patient is speaking, even if you are not hearing. Learn the art. It's very important. I had this wonderful sonologist. I still have her. When she came in from JJ, she just joined us. She was new. You can have a JJ come into into private practice, and that's very amusing. Because they're used to saying, "Bhai zopa, chadar kada, asa kara, tasa kara." And the private sector says, "बहुत गंदा doctor है." So we had to train this doctor. She was wonderful clinically, but her clinical sense and ultrasound understandings. But I remember this doctor had this very funny habit. She would put the probe there and she'd look at the screen. And she'd have those eyes looking at the screen, and every patient who get a sonography would come running back to me saying, "Doctor, माझ्या report मध्ये काहीतरी गडबड आहे." And I would say, "नहीं, report तो एकदम बराबर है." तिचे नाही, पण ते डॉक्टर असे ना जवळ घेऊन बघत होते, असे मोठे मोठे डोळे करून बघत होते. I had to teach my radiologist की छोटे छोटे डोळे करून बघा, मोठे मोठे करू नका, जवळ जवळ जाऊ नका. So when you're residents, look at what you are doing. Tell your friend to have a CC camera, show what you do. You'll be surprised to see how we look from the other side. We sometimes look funny. In fact, before today's talk, I had my wonderful two critics. I have three wonderful people in my life. My husband, who says I'm excellent for everything. So we have a very happy married life. My brother, who thinks that I'm the stupidest girl in the house, so he keeps telling me that. And my father, who's a teacher forever. So yesterday before coming, I was asking him, do I look too hard? Do I look too close? And then I also asked Anagha and Reena and everybody to tell me, how do I speak? Am I okay? Because I needed to know, because I can't see myself. Remember that. So as doctors, see yourself. Either CC cameras, ask your friends to record you. When you're talking to your patients, are you nodding too much? Or are you not nodding? Let yourself be inspected by yourself. We are expected to have all qualities on earth. You know, we are the ideal. We were the cream of society. If you know, when I don't know whether the young doctors have heard about it, but we were always called cream of society. Doctors are the cream of society. And I have started telling people, आजकल cream बहुत पतला हो गया because society toned milk हो गया है. So in the dietetic society, we are now very thin layer of cream of society, but we have to come up to the expectation of the community. So promise less, deliver more. You are responsible for everything, whether the ward boy is rude or the nurses are not good. Should I tell everything or should I not? I keep telling people, tell everything. Tell it in a way that the patient will accept it, and yet you've told it. So you may tell and you may not tell, you know, so you have to have that balance of how you're going to put it across to them. And why do we have to tell everything? Because the legality part of it is very important. Can someone tell me if I'm exceeding my time? So could someone just tell me?
Ma'am, actually we could around 10 minutes more.
All right. He says I have to run. So the most important legality aspect of doctors that you have to know, all of you, is that we have in the law books of India something called a fiduciary contract. Remember that doctors are judged differently. A patient can just allege negligence and it's your job to prove you were not negligent. It's the only crime in the courts of law where you have to prove you were not negligent. And this fiduciary contract is governed by a word called uberima fide, which means you are bound to tell everything. And therefore, please understand, there cannot be not telling because patient ghabril. There just cannot be. The law doesn't allow you not to tell every information. But you don't have to do truth dumping. You don't have to do misrepresentation. And most importantly, you have to know the difference between possible and probable. And explain it to the patient when you want to get their fear down, that it is possible, but unlikely because it's not probable. And when you explain that, you are giving them information, but not also scaring them. We are bound by the Hippocratic Oath. It defines how we can be. Unfortunately, we are in the world of hypocrisy, a very similar word. And therefore, this is something that everybody needs to wake up, that no matter what, the medical profession will still be expected to be the best profession. When the patient comes to you, I'm going to skip a little faster and go a little faster. Just like the patient wants to know only 4 things, the doctor should know only 4 things. Very clearly, he should know what is our objectives. 1, what's the diagnosis? 2, choice of investigations. Now, if you're good clinically and if you've picked up your disease very early on, then what you can do is only 2 kinds of investigation. 1, to prove your diagnosis, very pointedly correct one. And 2, to disprove your differential diagnosis. So if you have disproven your differential diagnosis and then proven your diagnosis, you don't need the multiple investigations that people talk about. The third is the line of management. Now again, medical students in municipal institutes, please remember there are 2 medical lines of management. Something is the first one, that is symptomatic management. Many of us forget to just relieve the pain, to just give fever alleviation, give sleeping medication, constipation relief. Diagnosis is needed, definitive management is needed, but don't forget the patient is desiring immediate symptomatic management. The minute you do good symptomatic management and then give breathing time for definitive management, patient's going to be more satisfied. Decision of urgency, confidence and ability to manage. This is something critical that I want residents to know. Don't make the urgency of losing a patient a reason to bring the patient on table. अगर जल्दी ऑपरेट नहीं करेगा, पेशेंट भाग जाएगा, That's not urgency. That is your commercial compulsions. Don't ever make that mistake, because if that particular patient lands up in complications, one of the cases that I know, patient had a heavy menorrhagia, first episode of menorrhagia, patient went to a tertiary care hospital, and in the patient's history, she has said she was bleeding like a tap. And the history after eliciting, the doctor has said a pipeline has broken, a tube of blood has broken, and then she has bled, and therefore they took her up for an urgent hysterectomy. That particular patient got a rectal tear or some complication. The doctor has lost the suit because the urgency was also false, and the patient was taken up for so-called unindicated, because without any kind of waiting of time. So don't make, for the sake of commerce, ever a case as an urgent case. Urgency has to be based on scientific evidence and your ethical skills to understand that science. Don't feel ashamed to call for help. In my practice, for my normal birthing patients, I have an assisting gynecologist, an anesthetist, and a pediatrician for all normal birthings. I remember a friend of mine saying, maybe you are a little darpok, that's why you are doing that. I don't need all this. And the same friend of mine has had a neonatal mortality very recently, luckily no medico-legal case. Because what happens is, in the state of Mumbai, the way the traffic is, you can't get help fast. So you might as well arrange help right before, you might as well seek assistance right before you get into trouble, and that will be called preventive, and it will be much better to ask for help earlier than not. The next slide is my favorite slide. Dr. S.V. Nadkarni's equation of severity index. Now this is a very funny severity index. It's the real severity index. Real severity is equal to medical severity into expectation plus paying capacity plus social status. Now I'll explain this very simply. Police has brought an injured with a CLW of 2 centimeter on the cheek, roadside beggar आया, CLW लेके Sceince hospital का OPD में. What is the severity index? Let's assume it's X. Deepika Padukone with a CLW on her cheek, 2 centimeters in Lilavati. What is the severity index? 1,000-fold. Suddenly it's the front page news. The scar is being debated and all the sciences to reduce the scar. Your severity index is not necessarily based on medical science. It's based on social understanding, expectations, awareness, power of the patient seeking it, and therefore understand this. You'll have to Indianize medicine. And I'm going to tell you about this Indianization. There are many factors that affect severity. We have applied this at Pikale Hospital, my practice, and we find it's very easy then. Once you apply this is a class by itself, but if you apply this and actually have a formula, which we have in our hospital, you can actually know which patient is meant for Sceince Hospital, which is meant for nursing homes, and which is meant for Lilavati, Hindu Chakhar, and others. Because this severity index has money, understanding, reasoning, suspicion, arguing, all as factors that affect the severity. If you don't understand the severity, just go to justdialmouthshut.com and see the reviews of doctors. And you will find sometimes very ordinary things are made and hyped to look like very extraordinary, because the doctor didn't understand that the patient's expectations were very high. The commerce, understand, without commerce, no medicine. Vitamin M, the absence of which, money, cripples the industry. Students will have to understand words like capital expenditure, depreciation, loan, EMI, and a whole lot. But I want you, there was a lot I wanted to say on this one, but I want to run through this. 3 words you have to know: cost, price, and value. Cost is the actual expenditure a procedure takes. Price is cost plus profit. And value is a perception of the patient. At Sceince Hospital, the cost is very high. It's the price which is not there because the consumer doesn't pay. But if you had to have the costing of all the salaries paid and all the expenditures that happen and the amount of colossal money that goes into healthcare, Sceince Hospital healthcare is as expensive as the private sector. Could be even higher because the salaries are higher. But people don't know it because there is no price. The price is the value that all of you will have to understand once you're out in the market. And value is a perception the patient has if they feel it was paisa vasool or not paisa vasool. So too much commerce, no value. Moderate commerce, great value. Society, like we have class, caste, I feel we have a class. The rich will go to the tertiaries, the middle will go to the middle level nursing homes, and the poor will continue to go to government hospitals. And each one of us will have to master the art, science, and commerce of that particular strata and serve the community with their expectations and their possibilities. We will have to examine the wallets of people. And let me tell you here, true clinical practice, as we practice in the world, is a mix of art and commerce with varied degree of science. What do I mean by that? Small disease, skin pe color acha nahi, Sangeeta Amladi knows that. She will have all this skin ka pigmentation, baal ugta nahi, whatever. Disease mein kya hai scientifically? Is it very serious? No. But a lot of art will go in it, a lot of commerce will go in it, and it will still be a viable business for people to do it. If it is a very major critical care, okay, maybe a Prakash Jayandani, he's not there, but critical care, the science is huge, again, the commerce is huge, but there is no time for art. People have no time to talk when patient is critical. So art and commerce will remain common. Science will vary as you treat patients. Marketing, an integral part of commerce, increases the burden on doctors. More you market, more awareness, more expectation, more panic, and will burden us further. Goals of healthcare, you should know very well. You must attract patients. Okay, there's a little sarcasm in it, but there's a lot of truth in it. You must retain them, you must expand the clientele, and you must make them pay profitably and yet happily. And the patient wants his goals, which means pay less, get more. And the balancing act between these two goals is where success lies. So as a professional, a good mantra, try to cure. If you can't, at least ameliorate. If you can't, at least please. If you can't please the patient because he's dead, then at least the relatives. Don't anger the patient. It's very important for you to learn this. The young friends here maintain a conduct that is immaculate. I had a lecturer at Wadia, and in Wadia, those Marathi bichara bais, and he used to say, "Bai, tu zhop, mi ata tula tapashnar, thodasa tula dukel, don't worry." And he used to say all this, and we used to think he's a fool. But what he did was he mastered the skills to such an extent of empathy, communication, that he had entire Wadia call him the god of Wadia. He subsequently went into private practice. He's one of the most leading, treating a huge amount of Bollywood stars, and he learned his art, science, and commerce there in Wadia. He rehearsed on those patients every moment as if they were Deepika Padukone's, and today he has that class. Every case teaches us a lesson. Sometimes we don't learn it. The poor come late. The signs and symptoms are very evident. Diagnosis very easy. Don't waste time on too many investigations. Treat them. That's what they want. Rapid treatment. Middle class, they come with a little early, not too early, but they want moderate cost, moderate investigation. Understand that and treat them. They're going to be damn happy. And the maximalists, the rich and affluent, investigate everything every time. Do everything every time, and know a few doctors in the USA, because after saying everything you have to say, they look straight into your eyes and say, "Doctor, is there any expert you know in the US?" So be prepared to have a few names so that you look like you're the guy who always interacts with the US people. How do you know you're doing the right thing? Just do ethical tests. Ask yourself, would I like my near and dear treated thus? So if I was across the table, is this okay for me? If it's okay for me, it's going to be okay for everybody. The second one, would I mind if the transaction is known to my patient? What's going on in my mind? My 2 rupee pen, ball pen, I keep telling them, is invaluable. It could write a birth, it could write a death. It could write an unwanted prescription, it could write an unwanted leave certificate. It's not 2 rupees, it's me. The transaction that goes in my brain is what my pen only puts on a paper, and I'd like you to be very conscientious about this. That's me telling all of you. the younger ones. I'm actually intimidated by my alumni seniors who are looking at me, you know. But for you guys, that's me. And that's you guys. I will be telling when a whole lot of doctors will be telling you, do this, do that, do that, do that. And we'll say, now take the leap. You may take the leap, you may take a U-turn, go back. You may take another route, there may be a better route. There'll be many ways you can reach the same focus, the same objectives called success. You can choose what you want, tread your own path. We look up to you to make the innovative changes that we desire to do, but may not have been able to do. Remember, medicine is not your life. Your life has many, many facets. I've seen a young guy taking photography. He's a photographer today. He's a second year, third year student. Keep your passions alive. Sing and dance. Play your table tennis. Do everything that you want. Follow your passion. Dr. Supe sir has his passion of photography. These are my friends from Sceince Hospital. We were called Mafia. Okay, so some batches above and some batches, I think all of you know that we are called Mafias, aren't we? The alumni. We were called Mafia, 12 of us always together. That's a photo when we did our third MBBS, and that's a photo we did it now. And my philosophy saying, do it right and chill. It's a translation of karma kar and fal ki apeksha mat kar, because once having done it right and done it right each time, just chill, relax. I'd like to quote what my dad quotes. He says, don't work very hard. He says you have to work hard, but not very hard. There's a Marathi saying, Prayatne valutse kada ragadita telahi gale, which means if you work hard, from a sand, you can take out oil. Okay, so Prayatne valutse kada ragadita telahi gale. Dad has added a corollary to it. And he says, Parantu tya yoge nara karonari madhumeha ani blood pressure zade. So don't work so hard. So don't work so hard till you get madhumeha and whatever. Don't. Chill, enjoy, share, have sportsmanship. Sceince Hospital is the place to give you all this. Team spirit. Smile. Smile a lot. It makes you feel good. Control anger and envy. Be happy. Be a wonderful future that we look forward to. Thank you for inviting me.